So the person that I chose to interview for this was my friend who has a good baseline knowledge of nutrition, but that's the extent of it. So I asked her to describe what she knows about nutritional genomics. She said that it has to do with your DNA and what you are predisposed to in regard to nutritional issues based on genetics, which is very good. It's a pretty accurate depiction of what it is. So I was very impressed with that. And then the second question, describe how you see nutritional genomics as relevant to your health and nutrition status. So she said, with her dad having diabetes, she wants to know if there's any genetic connection between them and then what foods she should be eating based on that. So I did suggest that if she wanted to look into it, she could kind of not strictly follow, a diabetic type diet, but maybe just adhering to a low carbohydrate diet. See how that works for her. And then after watching the video, her thoughts on whether or not she would be interested in doing this was that she was very interested. She said that anything personalized is more valuable, and I do agree with that. She didn't have any concerns or questions that came to mind when watching the video, but she did mention that she would only want to pay around 250 for this. So she was not willing to pay, a crazy high price, which I understand. So I would agree with that as well. And then so for her, the personal benefits to this testing was that she would know specifically how her body will handle the nutrients and what she can do differently to live a healthier lifestyle. Um, Also, in order to prevent diseases, she said. And then, so personal risks and ethical concerns. She saw no personal risks and no ethical concerns. But personally, I would disagree with her because you know, so in her situation, she's primarily of European descent, so there's not much ethical concern. But if she were of any other descent, there would be concern due to the results being less useful and even misleading in regards to disease risk because they have minimal testing on all different ethnicities. So, for her, there is, no risk, no ethical concerns, but for other people, there could be concerns. So, um, the additional information she wanted to know before getting tested was just how quickly she will get the results back, and then how does she know that it's accurate, which I thought was, with the accuracy, I can understand how that would be of concern when it's, a new idea in the field of nutrition. So assuming she got tested, the results would impact her psychologically by causing her a lot of concern and anxiety. She's already a very anxious person as is. So if she was to get a negative result, I think it would definitely, not be good for her. She also said it would really, increase her anxiety. But she said also if she did get negative results, saying that she was predisposed to certain illnesses, she would research as many preventative measures as she could and she would adhere to them. So I thought that was good at least. Um, so I asked her what if she found out she was at high risk for a disease for which no effective treatment exists? She said she would just eat the same. I mean, she said she wouldn't allow the test to change her dietary habits, even if she had no risk for disease or a huge risk for disease. So she would only make I'm sorry, I messed that up. She would only make the changes if there was a risk for disease. So she would not change her dietary patterns if she was told that, she's not going to develop X, Y, and Z one day, possibly. Only if the outcome is possibly bad would she change her dietary habits, she said. Okay, number 7. So, assuming she got tested, how would she respond if she found out that she would need to completely change her diet to improve her health and reduce her risk of a disease? She would be open to the change if she had guidance. She said she would try her best because she does want to live a long, healthy lifestyle, but she'd be more likely to make the change if she was given specific meal plans. She said it would be hard to adhere without proper nutrients, and she wants convenience as well. So she does not always want to have to educate herself on everything in each single food. She would be less likely to make changes if elimination items were the foods or drinks she normally consumes. So let's say they said, oh, she can't have caffeine. She drinks caffeine, habitually. She said she'd be less likely to adhere to that just because it would be so hard to break those habits over time. So her final thoughts about this is that she thinks it is a wonderful opportunity that should be available to everybody at a reasonable cost, that more people can be active in their health care. And I definitely agree with that. I think, you know, just having this information can be life-changing for so many people, so I wish it would be, more available. So if she was actually my patient and, I was talking to her about these issues or concerns, I would make sure that I wasn't pushing anything on her because, it's ultimately up to her what she's comfortable with, but I would also want to really educate her on the benefits that come with this testing, so that she's, has a full idea and a full understanding of everything before making a decision. So if she was the patient and she disagreed with something that I advised, I would also, in the best, most tender approach, give her the evidence behind it, and explain that in like easy terms for her to digest and understand so that maybe I could help, you know, her perspective change a little bit. So luckily for this interview, she was very open and receptive to the questions I was asking. She has been looking into something similar for her metabolism recently because she's been having fatigue and inability to lose weight and hormone issues. So she actually liked that this is something that she can now consider because she's never heard of it. She was very engaged and eager to learn more about nutrigenomics for her future use, which was good. So I have known her for about 2 years, and she's not always been receptive to nutrition initiatives for health. But her mother passed away of cancer, and then her father actually just passed away this year due to diabetes complications. So her views on health have, they weren't the most positive. I think she had a very negative view around, like, as people age, just they fall apart. So she didn't always have the best view on it. But when I started this program, I would speak to her kind of about nutrition and, the things you can do and prevent and all that good stuff. Um, and so she's actually become quite receptive to making these changes, and I'm seeing her make these changes every day. So, she's come a long way since I initially met her, to the point that she's even open to this nutritional genomic testing, which is honestly wonderful. Her background knowledge is still limited, but through this interview, I was able to discuss the benefits of testing and I was able to give her even more education on it so that she felt, more informed to make the decision and not just, oh, this seems kind of interesting. Like she can make a decision with lots of evidence behind it and know that she's confident with the decision she made. So this interview taught me quite a bit about consumers. So it's made me realize that consumers have a baseline of knowledge. Um, and they're sometimes gonna cling to that. Luckily, my friend, she's on the opposite end where she's very open, but I understand that there's also other people who will, learn a few things about something, decide they don't like it, and not really be receptive or open to, you know, trying that option out. So, um, really just depends on how open they are, but it also as like a dietitian in this scenario, it would be up to me to really explain this properly and make it easy for them to understand the good things that come from it so they wouldn't have to worry. But also, portraying both sides so that they can make that informed decision. So also when I was explaining to her, the topic of nutritional genomics, some parts were kind of hard because it's kind of a new area in nutrition. So there's all these or there's unanswered questions, so she was probing for more and more and there was only so many answers I had for her. So I think if I interviewed somebody else who had little nutrition knowledge or even just differing views on this, they might be pretty skeptical of this type of testing. I could see that definitely being an issue. So some things I learned though, I did learn that this is very new to nutrition. So that's probably why there's a lot of skepticism. There's also a need for more testing for different races and ethnic groups, which is very interesting. And then two opportunities to integrate nutritional genomic testing into nutrition practice for me personally would be, so the first one would be testing to determine who is predisposed to diabetes. So diabetes is one of the top 3 chronic diseases in the US. So after I completed my clinical rotation, it was really eye-opening just to see how many people actually have type 2 diabetes. It was it was practically every patient really. So determining if somebody is predisposed to this disease can really help me with preventing the development of it through their diet and their lifestyle. So that would be the first thing. And then secondly, um, also testing to determine heart disease risk. Again, this is also one of the top 3 chronic illnesses in the US. So this means there's like a huge need for prevention measures. So, again, knowing that somebody is predisposed to this disease can help the registered dietitian guide their dietary patterns more appropriately for their situation. So, the roles and responsibility of the practitioner to practice in an ethical, evidence informed manner is just according to the Journal of the Academy of Nutrition and Dietetics, and they state that the nutrition professional should understand, interpret, and communicate complex test results in which the actual risk of developing a disease may not be known. The practical application of nutritional genomics and dietetics practice will require an evidence-based approach to validate that personalized recommendations result in health benefits to individuals and do not cause harm. So I felt that that actually perfectly summed up how to provide the best evidence-based care to each patient.